in an attempt to interpret the struggle and to discuss this issue, which is certainly one of the most vital issues facing our nation. And so I'm very happy to be here.
Today, we seek to educate and empower around the issue of food insecurity and inequities in our region. The presenters and panelists will shed light on this pervasive issue that has only been exacerbated by the ongoing and relentless COVID-19 pandemic. I will be highlighting data released in the Capital Area Food Bank 2021 Hunger Report. Let's start with some background and a regional lens on food insecurity to table set our time together. Here, I will discuss some of the longstanding issues affecting our neighbors and the position that put them in before the pandemic, as well as a spotlight on how the pandemic has dealt multiple blows to the same set of communities in our region. Even before the pandemic, nearly 400,000 people were experiencing hunger in our area. The majority of those individuals and families were working often 2 to 3 minimum wage jobs in the industries that were hit the hardest. Some may have been donors or volunteers, but suddenly were finding themselves in need. This slide is a visual of that need. All 8 wards of the district, Montgomery and Prince George's counties in Maryland, Nova and Prince William County in Virginia. The darker the area, the more food insecure individuals are represented. The number of those who are food insecure in our region, meaning they are not always sure where their next meal will come from, has grown from 400,000 to nearly 600,000. That's a jump of about 50% just in this last year.
100 years later, the life of the Negro is still sadly crippled by the manacles of segregation and the chains of discrimination. 100 years later, the Negro lives on a lonely island of poverty in the midst of a vast ocean of material prosperity. 100 years later, the Negro is still languished in the corners of American society and finds himself in exile in his own land. And so we've come here today to dramatize a shameful condition.
Food and Friends is a DC-based nonprofit that's been providing healthy meals to thousands of Washingtonians since 1988. The organization prepares and delivers nearly 1 million meals each year out of its headquarters in Northeast DC. Since March of 2020, the amount of people needing their services has increased. Volunteer Services Director Katrina Mathis doesn't see that changing anytime soon.
Let's say during the pandemic, there was more light shed on the pre-existing inequities in communities. And with that, we had more people coming to us needing our services. But because of a lot of the very needed restrictions that were put in place, like social distancing, the mask, and then just a lot of fear of unknown, we had to almost half our numbers. 68% of the households we serve live on less than $1,500 a month, okay? So just knowing that, we are very well aware of the food insecurity issues and how they impact our clients.
So let's zoom in a bit on the district. This slide is a visual of the need in the district. The darker the red, the more food insecure individuals in the area. And this data reflects current food insecurity rates, which are down from the numbers seen during the height of COVID. The highest need, however, continues to exist within wards 5, 7, and 8, where unfortunately, most of these individuals are seniors and children. We have seen an increase in need in parts of wards 2, 3, and 6 since the start of the pandemic. Additionally, access contributes to food insecurity. Although some are shifting away from this phrase, food deserts are defined as areas in which it is difficult to buy affordable or good quality fresh food. Over half of these low resource areas are in the district's Ward 7 and 8, where for some time there was only one full service grocery store for each ward. Otherwise, residents there are limited to carryouts and corner stores?
So we know that food insecurity is a major issue in the District of Columbia. So I just want to jump on in, and I know you all are experts and will get to share your expertise in the field of food insecurity as you answer these questions. But I'd love for you to briefly tell us about food insecurity in the district as it relates to the people here and some of the areas that are impacted the most.
Absolutely. So at Martha's Table, we certainly believe every Washingtonian, regardless of zip code, deserves the opportunity to thrive. Yet we know that there are systems in place that disproportionately affect minority communities. So, for example, the issue of food insecurity has certainly been an issue that has long affected Black and Brown communities, especially east of the river, where there's only about 3 to 4 grocery stores serving about 160,000 residents. So that is something that we have paid attention to even before COVID. COVID exacerbated the issue, almost doubled food insecurity rates among our population. And we're seeing, while those rates are going down, it's still disproportionately affecting Latinx as well as Black communities to this day. So what we try to do is just to ensure that we are providing healthy food access at no cost to our residents, specifically in Ward 7 and 8.
Yes, you may ascend to the heights of academic achievement so that you have all knowledge. And you may boast of your great institutions of learning and the boundless extent of your degrees, but if you have not love, all of these mean absolutely nothing. You may even give your goods to feed the poor. You may bestow great gifts to charity. You may tower high in philanthropy. But if you have not love, your charity means nothing. You may even give your body to be burned and die the death of a martyr, and your spilled blood may be a symbol of honor for generations yet unborn. And thousands may praise you as one of history's greatest heroes. But if you have not love,
one day when the glory comes, it will be ours. It will be ours. Oh, one day when the war is won, we will be sure. We will be sure. Oh, glory, glory, glory. Oh, glory, glory.
Food insecurity has been persistent in our region and disproportionately impacts some of our neighbors more than others. Any discussion around food insecurity must come with the acknowledgement that this issue does not exist in a vacuum. It has many contributing factors and is most often an indicator of other individual or societal barriers. At the root of most food insecurity is financial instability, along with its numerous related challenges, namely the forced trade-offs between nutritious food and other necessities. Other common and interconnected issues include unemployment, low availability of affordable housing, disability status, social isolation, and transportation hurdles that make it difficult to travel to work or a distant grocery store. These challenges, too, do not exist in isolation. We must directly acknowledge the role that racism and oppression, both throughout history and in present-day structures, plays as a driver of the inequities that perpetuate these challenges and lead to their outsized impact on people of color. As a result, access to opportunity in our country and in our region is far from equal. Many of our neighbors are earnestly seeking opportunities to thrive, but are still held back by a web of interrelated forces that form barriers to progress. These and other disparities, which long predated COVID-19, were only widened by the events of the last 15 months. At this point, the fact that not all households were impacted equally is well documented. Analysis of the 2020 census household pulse surveys and other independent studies have revealed that the disproportionate burden of the pandemic on lower income Americans and people of color across numerous dimensions, including health, unemployment, and food insecurity. Accordingly, current socioeconomic indicators for Greater Washington are highly disparate between racial groups. Even before the pandemic, indicators such as educational attainment, household income, net worth, unemployment rates, and poverty were starkly different between white and Black or Hispanic populations within the region. As a cumulative indicator, life expectancy across Greater Washington varies dramatically, in some cases dropping 30 years over a distance of fewer than 10 miles. Ward 7 and 8 outpace Ward 3 by almost double. And we all know everything is harder when you haven't had enough to eat. Thinking, learning, working, achieving, everything becomes more difficult. So looking back over this last year, we know that the pandemic has not impacted our neighbors evenly across this country. We've learned through many different sources that people of color and lower income individuals bore much greater burdens over this last year. This is just as true within our region. This is a visual on the effects of the pandemic. And when you compare these maps side by side, it's clear that the same communities were hit by wave after wave of impact, from lost jobs to food insecurity to positive COVID cases. We are starting to hear that recovery is coming, unemployment rates are headed downward, things are opening up again. But it is so important for us to look more closely at those numbers and see exactly who is recovering and who is being left behind. What we see is those who were first hit hardest, those earning the lowest incomes, are the last to recover and still not doing much better than they were in April 2020.
We are coming to demand that the government address itself to the problem of poverty. When we reflect on the legacy of Dr. King, we often remember his quest for racial equality, but economic justice was also an important part of his vision and of his dream. In November 1967, Dr. King and members of the Southern Christian Leadership Conference strategized to launch the Poor People's Campaign. The campaign was designed to shine light on the problems people living in poverty confront, including food insecurity. Dr. King promoted that full citizenship was directly connected to economic security. In 1969, 31% of those living in poverty were African American and other communities of color. Today, that number hasn't changed much. The 2018 census shows 20.8% of African Americans and 17.6% of Hispanics live in poverty. Dr. King was quick to debunk the flawed stereotype that people living in poverty simply needed to pull themselves up by their proverbial bootstraps. Significantly, in 1969, 71% of the African American male heads of household worked, compared with 59% of white male heads of household. For African American women heads of households, 49% worked compared to 39% of white female heads of households. Thus, in the African American community, the high level of poverty and resulting food insecurity was not simply because of laziness. Instead, it was systemically connected to issues of racial oppression. On March 31st, 1968, Dr. King delivered his last Sunday sermon right here in Washington, D.C. at the National Cathedral. During the sermon, Dr. King spoke about his Poor People's Campaign, and he also spoke about the collective power of bringing shared concerns to leaders in Washington. He reminded those attending the service that 2/3 of the people of the world would go to bed hungry that night, and they are ill-nourished. When sharing his vision for the Poor People's Campaign, Dr. King mentioned, "This will be no mere one-day march in Washington, but a trek to the nation's capital by suffering and outraged citizens who go to stay until some definite and positive action is taken to provide jobs and income for the poor." And indeed, we did come and we did stay. Despite Dr. King's assassination on April 4th, 1968, his vision continued. On May 12, 1968, by wagon, by foot, and by busloads, a racially diverse coalition from around the country came to Washington, D.C. to demand economic justice. As a child, I recall sitting on the bus in Boston and people lining the streets as our bus departed, waving, cheering, crying, as we traveled to Washington to collectively continue Dr. King's vision to end poverty. It was quite a memorable moment for me as a child that I still hold on to as an adult. That march was accompanied by not just protesters, but a list of demands and a manifesto to address food insecurity. 10 days before the march, Reverend Ralph Abernathy upheld Dr. King's vision and visited the US Department of Agriculture to discuss food insecurity. At the USDA meeting, Reverend Abernathy asked that the USDA provide food stamps for those who could not afford them. He also asked that the government provide free and reduced price lunches for every school child in need. These initiatives may seem the norm now, but they were quite an accomplishment in 1968. Unfortunately, the struggle to address food insecurity launched during the Poor People's Campaign continues today. During that last Sunday sermon at the National Cathedral, Dr. King stated that new challenges create new opportunities. One new challenge he mentioned was developing a world perspective because the world in which we live is geographically one. During that sermon, Dr. King also reminded everyone that whatever affects one directly will affect us all indirectly. Thus, food insecurity affects us all.
At Food Jonesy, we are a small nutrition practice where we provide nutrition counseling and affordable nutrition services to all individuals, but we focus primarily on disadvantaged communities such as Ward 7 and Ward 8. And as a dietitian working in the communities, we do notice that a lot of our Ward 7 and Ward 8 residents struggle with poor nutrition or trying to adopt healthier eating habits. So at Food Jonesy, what we try to do is provide them with those nutrition practices and skills where they can implement at home. Because there is such a prevalent of food insecurity in Ward 7 and Ward 8, we always try to advocate and teach our clients and Ward 7 and 8 residents how to eat on a budget, ways to incorporate healthy foods with the resources that they have available. Working with Anthem, with Shamika, we were able to implement our program even further and reach those residents that we cannot reach on a daily basis and teach them like healthy cooking skills, but importantly, affordable and simple healthy cooking skills to help lessen the insecurity that they're facing at home.
Part of the vision at Food and Friends is that everyone can help. All of the meals provided by Food and Friends are free of charge, but they do rely on donations and volunteers from the community to continue their important work.
Xi Omega chapter has been coming to Food and Friends every MLK Day of service since 1999. That means that in 2022, on January 17th, that will be their 23rd year of consecutive service. That is huge. That is monumental. And this is what I know, they're going to show up. They always show up. They come, they show up, and they work. They're not here just to chit chat, and we love partnering with them and look forward to 23 more years.
Yeah, I know that you have a lot of community partners, and we've talked before about the major impact that COVID has had on the work that you all are doing with AmeriGroup DC. Can you tell us a little bit about the statistics and the findings you have regarding COVID's impact on district residents?
So not only have we seen an increase in the demand for food services, such as some of the partners that are on the line right now, but also the price of food. So even when it comes to supporting some of our partners and what they're able to do, they do so much with very little, but it's even harder during COVID. It's been even harder for them to stretch those dollars as the price of food continues to increase. So the fact that we're trying to educate members and district residents on how to do it on a budget, it becomes even more impactful because the price of food is just skyrocketing. So that's one thing. The other thing is the demand. The demand for our members to receive meals has gone up exponentially. I don't have the stat off the top of my head, but I know that finding food has been one of our top searches on all of our SDOH platforms. So whether it's Aunt Bertha or member services that are taking phone calls, food access has been number one. And so making sure that our members and our DC residents have adequate access to food has been a top priority for us.
Food access has been number one, and this is why we're having this conversation today. So I know you all have pretty much answered this question in much of your answers and in the work that you're doing already out there. But for the folks watching, can you please just break down a little bit of the scope of your work as it relates to addressing food insecurity? And since you're on the big bubble, why don't we start with you, Sharmika?
Sure, sure. So with AmeriGroup DC, we recognize that health priorities change based on the social determinants of health. So to us, social determinants of health are anything that allows or requires a member to not focus on getting into care or to not prioritize their care because they have other things that they have to worry about. So whether it's food access, housing, transportation, workforce development, all of those things are on the top of our list. So once we check those boxes off for members, we can say, okay, you're fed, you're employed, you're stable, you're housed. Let's get you into care. Let's make sure that you're following up with your doctor's appointments. Let's make sure that you're adhering to your medical prescription requirements, whatever that looks like. Let's make sure that we can check those boxes. And really, it boils down to if a member is hungry or has to decide to use their last dollar to feed their children or to get their prescription, they're going to feed their children. And so your attention to your medical needs goes to the wayside. A lot of times, especially in our black and brown communities, we only go to the doctor when we're sick. We don't do the preventative care. We don't do the things that keep us healthy, such as eating healthy and going to the doctor. And so we find that when we can address these things and we can provide and we can support stability, that then we can say, okay, now let's focus on your health care. And the one last thing that I will also say is we work with great partners in the district because you don't think to call your health insurance to find a meal. You don't think to call your health insurance to pay a utility bill, but you will lean on Martha's Table, Food Jonesy. You will lean on the great organizations that are in the district doing this work. And so that's why we align with great organizations like them to help them continue to do the great things that they're doing so that our members and DC residents have access to it.
I conclude by saying today that we have a task, and let us go out with a divine dissatisfaction. Let us be dissatisfied until America will no longer have a high blood pressure of creeds and an anemia of deeds. Let us be dissatisfied until the tragic walls that separate the outer city of wealth and comfort from the inner city of poverty and despair shall be crushed by the battering rams of the forces of justice.